My surgery was not one of choice.
Even though quite complex and scary, but it was the right decision to make.
A progressive lower extremity weakness, starting to feel that she needs to use a cane.
This surgery is quite complicated.
Living with chronic pain is not easy.
She could develop paralysis, she would be even being able not to walk at all.
It was affecting my nerves, my fine motor skills. It was affecting my balance.
Significantly risky procedure.
I could either wake up from the surgery and not be able to move. I am in excruciating pain. I mean, I barely got myself here with the crutch. My surgery was not one of choice. I remember coming to Cleveland Clinic on June in excruciating pain, going to the emergency room for an MRI.
So Hanan came in, and what she noticed was over the course of a period of 1 month, a progressive lower extremity weakness. So she's able to walk normally one day, and then all of a sudden she's feeling weak, she's tripping, and then within about a couple of weeks, she's starting to feel that she needs to use a cane. And by the time we saw her, she was in between actually cane and potentially requiring either a walker or considering the use of a wheelchair. So there was this really progressive lower extremity weakness.
She was complaining of numbness of the whole body, weakness of her arms and legs, not being able to balance and not being able to walk as easily as before.
I was in the doctor's room waiting for him, and in walks the doctor, had seen my MRI and said I was expecting to see a patient in a wheelchair.
And I think that the reason for your complaints are very, very clear, okay? You know, the spine is made up of, and you can see this clearly here, bones and discs and bones and discs and bones and discs. And the general image of the spine usually looks like a backwards, almost like a light C or a crescent. And you can see in your spine, it's a crescent, but it's in the opposite direction.
So in this case, we could see that Hanan's condition was already quite compromised and quite severe. And if nothing was done, she could deteriorate even further. And that means that she could develop paralysis, she would be even being able not to walk at all.
It was fairly unexplained and happened rather suddenly for her. This is a fit person who does yoga, every couple of days, goes for 5-kilometer walks with her husband. So this is a dramatic change in terms of her overall quality of life and her overall function.
6 years later, I end up back at Cleveland Clinic, this time in an emergency situation, not really having a choice. And I, though felt completely safe, I trusted the diagnosis from the get-go. I actually, to be honest, I didn't even question what the details of the surgery.
We're going to be talking about surgery because that's the only possible option to correct this, especially in light of the continued worsening in terms of your function, your ability to walk, and essentially your ability to move. So we need to consider surgery.
that if nothing had been done surgically, she would not improve and she would deteriorate further. So it was crucial for her to have surgery at this point, even though quite complex and scary, but it was the right decision to make.
Anesthesia is also a very important piece of this puzzle that is made for a successful outcome for the patients.
In Hanan's case, actually, or ironically, I should say, the decision was a little bit easier for her to make because she can see that over the course of the month, she was getting progressively weaker, and nobody wants to be in that position. And so as a result of her deterioration over the course of a very short period of time, she could sort of see that she was getting to the point where she might not be able to move her legs if she continued along this path.
This surgery is quite complicated. So from our side, we have to assure the patient that she's not going to be aware during the surgery, that she's not going to feel any pain during the surgery. And after the surgery, we also inform and discuss with the patient what we can do to avoid pain after the surgery.
We made it clear to Hanan that this would not be just having the surgery and everything will be fine. No, her condition was quite severe and complex, so this would demand a lot of little steps, but hopefully in the end we would accomplish the main goal, which would be to give her life back.
You're in the best hands you're going to be in, and things are going to get better.
I completely trust you. I am just going to trust you and trust in God, and we're going to go for it.
Okay.
I'm not going to even consult on this. I'm just going to do it.
So the role of the neurophysiologist in the operating room is to monitor specific neural structures that we have running along the spinal cord. And these structures are very, very important for us to be able to move our hands, to feel our feet, our arms, right? So we use arms and legs in our daily routine, daily life. So we do this by applying specific electrodes on the head and throughout the body. And then that means that we can run through the spinal cord little signals that we can monitor and check and make sure they aren't changed throughout the whole surgery.
So during anesthesia, we act in all the organs and systems of the body. To start, we turn off the brain. So we have to monitor the brain. We use electroencephalogram during anesthesia, and we see the action of anesthesia on the brain. We monitor the blood pressure, the heart rate, and the way that the heart is pumping the blood to the entire body. We monitor the respiratory system with the lungs and the pressure within the lungs during all the part of the anesthesia.
Knowing the team that's involved, sort of knowing the background of both the physicians and the anesthesiologists, as well as the fact that we have a very solid neuromonitoring program here where we literally can monitor the spinal cord before, during, and after surgery, really makes a big deal in terms of giving people sort of the added security and the added trust that comes with doing such a delicate and, I think, significantly risky procedure. So post-operatively, I often see my patients back in the post-anesthesia care unit, and they're kind of awake enough to know what's happening. They certainly know if they're moving their arms and legs, and they're aware of that part of it. And so Hanan was really excited that she could move her arms and legs, that the most devastating complication on her list of complications was not going to be a real thing, that was in fact a very low risk, and that she made it through surgery very successfully.
All right, I feel a bit tired.
Feel a bit tired? That's totally expected after the anesthesia. The surgery went really, really well. Took about 2 hours or so it wasn't much of a procedure, fortunately enough.
Living with chronic pain is not easy. It's you know, I have coped with it for years. I learned to medicate in different ways, not necessarily taking medicine, but really trying to stay busy, active, occupied, but it all came at a cost for sure. There's a lot of you know, anxiety, a lot of, you know, sometimes I would wonder if I could wake up and even get myself to the bathroom, for example. Like, it was, you know, that intense at moments. Type of surgery that if it's successful, there's like really instant recovery, because the spinal cord was so severely compressed. It was affecting my nerves, my fine motor skills. It was affecting my balance. It was affecting my strength, like all of these, weakness, numbness, and imbalance.
I want to see you move your fingers, your hands all the way up and down. Good, and all the way up, all the way up, all the way. Good, 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 good. Excellent. Squeeze my fingers, squeeze my fingers. Good, and now you can just relax your hands. Perfectly fine. Great.
I did this before.
Yeah, things are already better, and we can see that on the neuromonitoring in the OR, so I'm not surprised you're feeling that way. Move your feet up and down for me. Good, and bend your knees. Excellent, excellent, good.
I could say now that Steve, my husband, who was there with me 24/7, my daughter Tala, my son Badr, our caregiver Julie, like, who were there all the time. They really, really were my backbone in this process. But also my community. I've a very strong and wonderful community of friends.
I never had any doubt that she was in good hands, and I never had any doubt whatsoever that she had the best chances of a positive outcome. I didn't question that at all.
I think the unique thing and the beauty of working at CCAD is that we all know each other. It's like a big family. And so that means that many times we don't have to talk to each other. We know already what's happening. Everyone is in the same page. And this happens when we have so many experts in the different fields.
Teamwork, again, is essential for a good outcome for these surgeries. The planning and the good interconnection between surgeons, anesthesiologists, neurophysiologists, anesthesia techs, scrub nurses, all radiologists, all this teamwork is essential, and it's my impression that we cover all this here at CCAD.
As the place where I was treated, the wonderful team of surgeons and specialists and nurses and staff, and also the wonderful place. I mean, what better place could I imagine to have spent my time recovering, both pre-surgery and post-surgery?
Yes, I think we can say that Hanan has been able to go back to her normal routine, to do the things that she enjoys doing, like painting, going to the gym, going for a walk, which is so important in everyone's life. So I'm very happy that we are able to give our life back. And I think I'm blessed to be working here with such a great team here at CCAD and being able to help, this country's people.
I think certainly there's no question that her surgery was a huge success. So not only is Hanan walking or ambulating or doing all the things that she wants to do from a physical perspective, but we don't have to worry about her spinal cord anymore. So we've sort of mitigated any significant future risks that she would face after the surgery that she's had.
She's 100% better and very active. In fact, she never really slowed down. Even while she was in hospital, she was still working.
Hanan is very much I'm much more in touch with who I am, because when you are sick, when your health is at risk, nothing else matters.